And we'll get a look at the state's spending on infrastructure in January, when Governor Kathy Hochul proposes her executive budget for the next fiscal year. But turning now to the state's overdose crisis. September is Recovery Month, and we're looking at the ways the state and others think about addiction. Reporter Alexis Young is here with more. Alexis.
Thanks, Dan. Overdose deaths in New York State hit record numbers in the aftermath of the pandemic. In August, State Health Commissioner Dr. Mary Bassett announced a standing order for the overdose reversal drug naloxone, or Narcan, in New York State pharmacies. That's one example of how the state's focusing on harm reduction strategies to curb the opioid epidemic, something that nonprofits and advocates have championed for years. Dr. Chinazo Cunningham is the commissioner of the State Office of Addiction Services and Supports, also called OASIS.
We're now in the process of establishing a new division of harm reduction here at OASIS, but really recognizing that as more and more people are dying of overdose deaths, we have to focus on keeping people alive, period.
And there's some historical context for that too. Commissioner Cunningham says the state is looking at it through the lens of the so-called war on drugs, which had disproportionate outcomes for people of color.
We know there's a history of racism, particularly around drug policies in this country. The war on drugs is one very specific example of really racist policies. We have to acknowledge that. We have to say those words out loud, and we have to do everything we can to right those wrongs. And so thinking about who is at highest risk and making sure that there are equitable services and really focusing on equitable treatment outcomes is absolutely critical.
Community providers think of this in a similar way. Project SafePoint in the Capital Region offers harm reduction services at no cost, things like a clean syringe exchange and overdose prevention training. Candace Ellis, the executive director, said that's to meet people's needs at their own pace and on a broader spectrum.
Substance use is something that many people do. Some, a glass of wine at night, or someone smoking crack. It's a continuum as to what that level might look like. So whether it's a substance that is legal or a substance that is illegal, it's very common for someone to use a substance for a particular way. So we just normalize that here at Project SafePoint, that use is something that we see on a regular basis, and sometimes it's more problematic than others.
If you or a loved one are struggling with substance, please be safe. And we'll put some resources up on our website. That's at nynow.org. Dan?
Thank you so much, Alexis.